graduate clinician at the UNR Speech and Hearing Clinic, and I'm here today with Nick, who's going to be helping me demonstrate the vocal function exercises that you can use either just as a warm-up if you're a singer or if you're trying to coordinate your different systems in your speech mechanism. So today we're going to do a couple different exercises, 4 to be specific, and their main goal is to coordinate your respiration or your breathing. And we want that to be coming from right down here in your abdomen. So when you're breathing, make sure you're really engaging that diaphragm and our stomach's coming out. So we get a nice full breath. We're also going to be incorporating our phonation, which is our voicing. So that's when your vocal folds are moving. And then lastly, we're going to coordinate your resonance, which is the sound in your mouth and how it's being shaped by those different articulators in there. Does that make sense? Any questions?
No, it makes sense.
Okay, perfect. Then we'll go ahead and get started. So we're going to start with a nice warm up just to loosen those vocal folds a bit. So make sure you're sitting nice and tall. And we're going to practice doing a nice deep breath first. So making sure that we're feeling our diaphragm contracting. So we want our stomach to go outward. So when we breathe in, we want should feel it going out. So go ahead and practice that. Perfect. That was great. So now we're going to apply that breathing. And what we're going to do is we're going to be practicing sustaining this note, which is an F. And we're going to make the sound E with this note as quietly as you can without your voice sounding breathy. So for example, E. And then you'll hold it as long as you can. Are you ready?
Yeah.
Take a deep breath and start whenever you're ready. Nice, that was great. Did you feel at the end where you started to waver off a little bit? Feel free to stop because we want it, rather than how long we're doing it, we want the quality to be the best, okay? So we're gonna try that one more time. Nice deep breath. Whenever you're ready, begin. Great job, that was awesome. So now we're going to move into our second type of exercise, and that's going to be a lengthening exercise. So we're going to start at your lowest comfortable pitch, and we're going to rise it to your highest comfortable pitch. When we do that, our vocal folds are being stretched. That's why it's lengthening. So for example, you're going to use an ooh sound. You're going to start as low as you can and go to as high as you can comfortably. And you want the sound to create a buzzing at your lips. So you want that resonance to be really far forward. For example, ooh, you want that buzz of your lips. Would you like me to show you again?
No, I think I got it.
Okay, go ahead and try then. Nice deep breath.
Ooh.
Nice, that was good. So we're going to do that again. And we really want to make sure that sound is nice in front. It almost should be a little bit like a mosquito buzz in the front as you're going up. For example, ooh. You want that buzz in there. Go ahead and try. Deep breath.
Ooh.
Perfect. That was great. Now we're going to do some strengthening adducting motions. So you're going to start from the top and go down. Same thing we did. We're going to go ooh. Great. We're going to do that one more time. Take a deep breath. High as you can to low. Nice job. That was excellent. Now we're going to do some vocal strengthening exercises. And this is going to be working on that phonation. The point here is not to do it as long as you can, but we want the quality to be the best it can be, okay? So we're going to start at our C. You're going to make that same ooh, except I want you to hold it as long as you can while it's still that nice quality. We don't want any breathiness in there, okay? So I'll demonstrate. Ooh. Just like that. Hold it as long as you can. Your turn. A little high. Let's start with the hum. It's a little easier. So we'll go. There it is. Now we'll transfer that into an ooh. Okay? Deep breath. Make sure that stomach's coming out. Nice job. We'll do that one more time. Deep breath. Great. Now we'll move up a note. Feel free to hum first. Great. Now when you're ready, take a breath and go ooh with that note. Amazing. One more time, deep breath. Awesome. We're going to go up again. Feel free to hum first. There it is. Awesome. One more time, deep breath. Amazing. Two more notes and we're done. So moving up again. Nice. One more time, deep breath. Great. And one more if we can reach it. If not, that's okay. Hum first. That might be a little high. Let me step down a little bit. That's okay. Deep breath. Great. One more time on your own. Deep breath. Nice. That was amazing. You did a fantastic job. So all four of those exercises, that warm up with the E, that lengthening going from lowest to highest, and that compressing that high to low, and those 5 notes sustain, those are going to be the exercises that you're going to be using for the next few weeks. And with those, you'll do them twice a day, once in the morning and once in the evening. Does that sound like something you think you can do? Awesome. So I'll go ahead and give you a nice chart to keep track of that, and we'll see where we go from there. And remember, the goal is to create a good quality and not breathiness. So even if it's only 4 seconds, make sure the quality is the best. As soon as you start hearing that wavering breathiness, that's when you want to stop. Do you have any questions for me?
No.
Okay, perfect. Thank you so much.
So as we saw, as demonstrated earlier, the vocal function exercises are a collection or a group of exercises that are done with a patient who is either having difficulty coordinating the various substructures or subsystems of voicing, or if it's for an individual who's really trying to maintain proper vocal hygiene, such as singers, professional voice users, etc. And within those different groups of exercises, there's 4 kinds. There is the warm-up that you'll start where it's a prolonged E, typically at the F below middle C for men and the F above middle C for women. Following that, you will work on lengthening exercises, which is starting at the lowest comfortable pitch, rising to their highest comfortable pitch. Following that is your contraction exercises, moving from the highest comfortable pitch to the lowest comfortable pitch, ending with the power exercises, or also known as the low impact adductory power exercises, where you're going to sustain a set of 5 notes depending on their fundamental frequency. Overall, all of these exercises should be done in a way that the manner of the production is what the priority is. We strive to have the manner produced be engaged, as Stempel states. We don't want disengaged or breathy, because that's not going to help strengthen those intrinsic laryngeal muscles. So if breathiness is occurring, go ahead and advise your client to stop, and then we'll work up to those longer seconds. That's the point of the program of using these exercises. Most often these exercises are prescribed or used from a 6 to 8 week period, depending on the various needs and individual aspects of a particular client. And at that point, you can make different adjustments based on their needs. After that 8-week mark, there is typically a period where those exercises are still done every day, but they're done in modifications. So slowly, week by week, they're weaned off of the full program and they complete less and less exercises. The way that you could apply this various exercise program in terms of a SMART goal for a patient, you could definitely introduce it as a program as typically done or individually as well. But the example that I have came up with is that the patient will coordinate various vocal subsystems using vocal function exercises by producing sound in an efficient manner, yielding improved or normal voice quality and vocal endurance in the presence of existing functional voice disorders with 85% accuracy by 6 weeks. So like I said, this technique can be used with those who do not have voice disorders or those who do. It works for great. If anything, it's just like when you go to the gym and you're working out your muscles in any other part of your body, you can always strengthen those muscles for your voice. And the 85% accuracy stems from stemples cut off for when they start to wean the clients off of the everyday doing every single exercise. In order for a client to move to that next level, to do less exercises per day, they still have to maintain 85% accuracy or quality in their seconds in production. So that's where that came from. In terms of the entire exercise itself, I learned the techniques for this from the book titled Exercise for Voice Therapy, which was written by Allison Burham and John Haskell. And the actual exercises themselves were coined or put together by Joseph C. Stemple. So you can refer to that book if you would like to learn any more. Thank you so much.